Discussing healthcare, let's look at an example where an employer offers healthcare plans to its employees with a $4,500 deductible. We'd like to know how this $4,500 deductible affects the frequency of which medical services are used by the employees. Well, what we know of this deductible is that $4,500 must be paid prior to this is like the out-of-pocket cost, so $4,500 out-of-pocket. So this is essentially telling us that these employees, if they receive medical services, they need to pay $4,500 in medical services over the course of the year before insurance kicks in and starts covering their services. So this $4,500 deductible, that's pretty high. So this is going to tell us that the frequency of medical service usage is going to decrease. We're going to see definitely fewer medical services being used because people don't want to have to pay that $4,500 over the course of the year. That's a lot. So they're really only going to be reaching that deductible most likely if something drastic happens, if they require some major medical service that is that expensive. But most minor usages of medical services are going to fall far below that. So people are probably going to limit their usage of those medical services for the reason that they just don't want to spend $4,500. So we're going to see a definite decrease in the frequency of medical service usage. But now let's suppose that a maximum deductible is set at $200, meaning that the employer cannot offer healthcare plans with deductibles that are greater than $200 per year. With this, what is the effect on the employer and the employee? So who is going to be worse off? Who's better off if either one of them? Well, with this maximum deductible of $200, like we just said in this last problem, because $4,500 was so high, these employees are not going to be going to the doctor as often. They're not going to be using their medical services. But now that the deductible is only $200, which is a much more manageable amount, we're going to see these employees be much better off. Right? Because all of a sudden they're able to use these medical services. And once they reach that $200 deductible, their insurance is going to kick in and start to cover some of these costs, which makes it really easy for them to utilize medical services. On the other hand, the employer is likely to have to pay more for these insurance. He's going to have a higher insurance premiums is essentially what that's going to tell us. So the employer is going to be worse off. Now, this is saying that the employer, whatever they are offering, whatever this healthcare plan is, right, because they're paying for this for their employees, the employer is going to have to make up for that low deductible in premiums. So the employer is going to end up being worse off by paying more for this healthcare plan for its employees, even though the employees are much better off, being that they're more able to use these medical services at a much lower cost given in this deductible.